It's not showing start recording yet. There it is. Hi, so welcome to this Homeless and Rough Sleeping webinar on children and families. We were to have held this webinar on the 16th of December, but due to the announcement of a level 4 COVID response before Christmas, regular meetings were cancelled, so we have recorded it without an audience on the 6th of January. My name's Debbie Kennedy and I'm Head of Clinical Programmes from NHS England Improvement. So we'd like to extend a welcome. Also on the call are Karen Simmons from OHID and Jane Cook from DLUP, the Department of Levelling Up. Okay, so Sam, would you like to start your presentation?
Hello everyone, good afternoon. My name's Sam Pratt. I'm from the Shared Health Foundation. We're a not-for-profit based in Greater Manchester, and basically we're here to reduce the impact that poverty has on people's health. We do that through lots of different kind of creative and innovative ways, which I'll go on to explain a little bit later. But essentially, we're funded by a trust in Greater Manchester to take risks. So we're a clinically led organisation that we can go and try things out. Yeah, I'll go through a little bit of kind of different things that we're going through. So next slide, please. So if you didn't know where Greater Manchester was, that's where we are, slightly in the north of England. We work across all 10 boroughs of Greater Manchester. We started off in Oldham and now we're the full county-wide with projects all over the place. We're a small team of about 12 to 15 people, mostly part-time. Essentially we're a clinically led organisation with kind of A&E doctors, clinical psychologists, midwives and nurses and people like that. And then a lot of kind of policy and advocacy housing campaigning teams as well that work really well to each other. Our clinical teams see things that happen on the ground, any kind of like cohorts of people that fall through the gaps, and then we try out new things and see if we can improve people's health. And essentially we're just trying to bring a bit of hope into really disadvantaged areas all over Greater Manchester. Next slide, please. So as I said, we're all about health inequalities and looking at the wider social determinants of health. We're philanthropically funded, so we've got the privilege to take risks and to try things out and to see if things work or don't work. And social justice and health inequalities are really at the heart of what we do. Next slide. A few of our projects, just to give you a bit of kind of like structure to kind of the things that we do. So we've got one, something called Lemonade Project, which is about mental health in young people. We realised that a lot of clinical staff don't get taught how to talk about self-harm and things like that when young people are in secondary care. So we've created lots of resources to support people to have conversations with young people about that. We've got the UK's only GP training scheme that focuses specifically on deprivation. So we tried it out and started our own project, which is now part funded by Health Education England. And we've got lots of work with perinatal support. So we've got clinical psychologists working in primary care. We help run the Oldham Poverty Truth Commission. And then we've got Focus Care as a project with our homeless families, which I'm going to go into a little bit more detail now. Next slide, please. So Focus Care. You might not have heard it if you're not in the north of England or specifically Greater Manchester, but essentially Focus Care supports households holistically. We've got a low entry and exit point. So essentially, is a household or is a patient chaotic, and their exit point is, are they at a point of stability? It's about the failure to thrive. We've had workers working in primary care that just realised that we had patients that we didn't quite know what to do with. We call them the heart drop patients. Who are the patients that are keeping you up at night? And essentially they'll be the ones who do not attend regularly. They'll be the ones falling through the gaps. They'll be the ones who are on the list, but you just don't quite know what's going on. So Focus Care is a bit more than social prescribing. So social prescribing is fantastic for those who have their lives a little bit more together than those who don't. This is for households that are quite complex, that are quite complicated and quite chaotic as well. Focus care holds the risks, and we unpick the problems behind the problems. You know, things that including kind of like domestic violence and drug misuse and homelessness and things like that, or kind of like things that we're dealing with day in and day out. And essentially, we're trying to make the invisible patient visible and bring in hope into people's lives, especially in the most deprived areas of Greater Manchester. And we're all about accessing and addressing the wider social determinants of health, because if you don't understand their housing situation, their family situation, their financial, the benefits, all that kind of thing, then you'll never get them to, you know, take their diabetes medication or go for a smear or address their kind of physical and mental health needs. So we look at the household holistically, and then work from there to address their physical and mental health needs. So Focus Care started a few years ago in one GP practice in Oldham, and then from there we expanded it. We got some extra funding from the Manchester Development Funds, and so we're in over 96 practices across the whole of Greater Manchester, looking after about 5,000 households, which is absolutely incredible for a small little organisation like ours. So we took that kind of model, and then when we found out about kind of like the homeless families and kind of like homelessness situation in Greater Manchester, we decided to pilot Focus Care, but specifically for homeless families, taking that holistic household approach, but bringing it inside a household team. Grab the next slide, please. So that's a little bit of kind of a balance to show kind of like what we work in. So from social prescribing and what Focus Care holds with, we're kind of the higher end, the more complex, more chaotic patients. If you want a little bit more detail on that, I can give that later. Next slide, please. So, like I said, we took the Focus Care model and then we put it with homeless families. We noticed in our primary care work that there was families coming in who lived in something called temporary accommodation that we didn't really know anything about at the time, a few years ago. And so after a bit of digging, we found that this issue is not just a Manchester problem, it's a nationwide problem. The most recent stats is about 126,000 children are living in temporary accommodation at the moment. And there's a lot of issues within Greater Manchester of unsuitable accommodation, children being placed in B&Bs mixed with adults and families, and lots of other issues as well. So essentially we took our kind of holistic approach and put it inside the local authorities of Salford and Oldham, and we work within the housing teams. So instead of working inside a GP practice, we take our household approach to work in the housing teams. We did that at the start of COVID, and was working with all the different kind of restrictions happening at the time, right at the start of April 2020. And essentially we take the heart drop patients. We talk to the housing teams, they refer patients and households onto us of ones that they just don't know what to do with. They're ones who have fled domestic violence, who have lots of drug misuse. There might be repeat homelessness as well. But essentially we're looking after the families of mums and dads or single parents with children or pregnant mums as well. And when we say we look after them, we support them, what does that mean? That's pretty much anything to get them to a point of stability. So they're going to come with multiple disadvantages. They're going to come with lots of trauma, with ACEs, domestic violence, and navigating housing services on your own can be quite overwhelming. So that's when Focus Care walks in and walks into that mess and stands alongside you, helping you with the rent arrears, benefits, housing appeals, hospital appointments, as well as providing things like food banks and baby banks and kind of like access to all them. Liaising with social services, housing officers, police, schools, health visitors, midwives, and basically any other professional that this family will come into contact with. And we're looking after about 50 families at any one point over Salford and Oldham. But there's problems that we keep coming across time and time again that isn't just a Greater Manchester issue, it's a nationwide, as my colleagues in the rest of this presentation will talk about, is that families get placed far and wide. They'll get placed over the borders. They'll be placed into accommodation that is unsuitable, that's not safe. They'll get placed into accommodation that is shared with other single adults. They'll get placed in accommodation where there isn't a cot or a a Moses basket. There's loads of other reasons and loads of other things which are traumatic. Homelessness is a traumatic experience, not yet recognised as an adverse childhood experience, but it does add on to the experiences of these families. So we just try and do our bit. We're not changing the world. We're not going to fix everything overnight. We're just trying to do our little bit to help make these families' journeys through homelessness just that little bit more compassionate. So there's all these type of things going on, and your questions might be, well, what can we do about it? We've got lots of families living in temporary accommodation and B&Bs, and there's loads of things that can be done, big and little. Can we have the next slide, please? There's lots of things going on. We can't fix everything overnight. Us and an organisation called Just Life are starting an all-party parliamentary group for households and temporary accommodation. So we're going to look at the homeless families kind of systems issues, on a nationwide bit. But you might be thinking, well, me as a local authority, me as a health visitor, me as a nurse or something like that, what can I do What can I do to help? Essentially, kind of, as I said, homelessness is not recognised as an adverse childhood experience yet. If you can just do simple as that and put that under your plan, your remit to kind of have that kind of like household approach and holistic approach for children suffering with ACEs. Homelessness is a traumatic event and will eventually lead to further homelessness if not addressed properly. Something called a notification system. You might not have come across this because possibly there really isn't one going on at the moment. Families are placed in various places all over the borough and outside of the boroughs, but their GPs and the schools aren't notified, and we're working on a way to basically link them all up, so it's an automatic notification system that schools and GPs know when a family is placed in temporary accommodation or B&Bs or something like that. We're trying that in Greater Manchester, and if there's something going on in your borough or your area, then please get in touch, and we'd love to work with you on that. And saying that, once the schools get notified or the GPs get notified, we've had schools ourselves go, well, what on earth do? We know this family's homeless. We've got resources that we can send you to, basically almost like a cheat sheet or something that you go through to help to support those families, because you might not know what to do. But basically schools are a great place to start to put wraparound care for these families. And it might seem a simple thing to say about stop using B&Bs for families. We know that's really difficult, but it has been championed in Manchester. Manchester City Council have opened their own bespoke accommodation just for families, which are self-contained flats and things like that. So it's difficult, I know, and local authorities are under massive pressures with budget constraints and times and all that kind of thing. But just to give you the hope that it can be done as well. We want to stop families getting mixed in accommodation with adults. And also we want local authorities to take on responsibility to provide the provision of cots and Moses baskets. Now, these are some of them are massive, some of them are little, and some of them are kind of like, well, where's that money going to come from? And we understand that, these things can't be changed overnight, but these are like really basic things that can be, put in plan, can make a massive difference and ultimately save lives for these families living in temporary accommodation. And the last slide, please. There's a lot to take in. There's a lot of things with the homelessness sector which it can seem unattainable at times, and you might be an expert on it, which is great. I'm certainly no expert in this, but we've seen so much happen over the past couple of years during the pandemic that we didn't think would happen beforehand. And when there's the right will and there's the right kind of working together and collaboration, we can see some massive change happen get done. But it doesn't mean you have to change the world today or tomorrow. As we always say, that Matilda says, if you can only do a little, you can do a lot. So I just want to really encourage you that whatever you can do, as long as you can do a little, you really will change someone's life for the better and change these families' lives and make the whole system that little bit more holistically and a bit more safe for them. So yes, thank you very much. My name's Sam from Shared Health. If you want to know any more information about our work, then please do get in touch. Thank you.
Thank you, Sam.
Thank you very much, and thank you, Sam, for a wonderful presentation and enabling me to build on that really with the work we do. So I'm Monica Lackenhall. I'm a Professor of Integrated Child Health at UCL Great Ormond Street Institute of Child Health, and I lead a programme of work really based in the community, working with families experiencing marginalisation, whether that be due to religion, culture, where they live, poverty, and in this case, families experiencing homelessness. I'm also a practicing paediatrician. I'm a consultant paediatrician in North London in the Haringey area. So I do see a lot of families who are living in deprivation, poverty, and also struggling, and some who unfortunately end up needing a great deal of support at the other end of the spectrum. And more I've got interested in how can we prevent families ending up in a situation where really life just becomes so difficult for them, that this then has an impact on their children as well. So I hope over the next 10 to 15 minutes I can just tell you a little bit about a project that we've been doing. And as Sam said, you know, he's been presenting his work about the experiences in Manchester and has been a great support for our project. But our project is a national project called the Champions Project, really trying to find evidence and providing evidence so that we can take action. Because as you all know, without evidence, we can't make change, we can't provide data, and without data, nobody will listen to us. So please just bear with me and we can have some discussion about this afterwards. Next slide, please. So what is homelessness? And we've talked a little bit about this already. We think about children in bed and breakfasts and hotels, people who are sofa surfing, and sometimes even children who do live in tents and are actually in cars. We've seen some pictures of those recently with COVID, and families moving into poverty and losing their homes. Traditionally, we often think of the picture on the left-hand side that you see here, which is in a low middle income country, as a child who is on the street, a child who is homeless. And when I've had conversations with people in the UK and I say, you know, children are homeless in the UK as well, and they'd say to me, really? They've got a roof over their head, so how can they be homeless if they have a roof over their head? Well, just having a roof over your head is not the same as having a home. And I think that's something that hopefully we can all discuss together, and have a national voice about. A roof is important. And if you consider Maslow's hierarchy of needs, yes, it's important. You have to have a roof over your head to be safe. But there's more to being safe. There's more to being secure. And there's more to responding to your child's needs. The picture on the right is an environment where some children are living very cramped, hardly any space to move, very little sunlight, stressful situations, nowhere to store food. And if you think of having that day in and day out, what impact will that have on that child as they're growing up? Next slide, please. So just to give some context to really what we're talking about, because I think it's important that we think of this not just from a child health perspective, but also from an environmental perspective, education perspective, and work across sectors really, from housing, education, health, and try and break down some of the barriers that have been put in place really because of how our systems are set up. So can we create a new system without the walls that we have actually created for ourselves? So this slide here really just tries to talk about, when we think of a happy, healthy child, what are the building blocks that the child needs? And we know that they have to be physically healthy, they have to be able to develop, they have to be safe and secure. And I think that's something we really need to consider when we think of children experiencing homelessness. You're in environments sometimes when there's noise outside, where there's drug addicts, where there's people shouting, screaming. That feels very unsafe for that child. Secure, do they really feel secure when they see their toys and their clothes in a box and they know that tomorrow they're going to have to move? And if they're in one bed one day and then waking up in another bed another day, how does that affect the development of the brain and that security that that child needs? And we talked about trauma, and this is one key trauma that we understand impacts on a child, that movement from place to place, that insecure feeling. You have to have a feeling of belonging. We know that often kids will want to put their pictures up. They have their favourite toy in a corner in a room. And again, if that's constantly being displaced, how do you have a feeling of belonging? You have to have good self-esteem, and good self-esteem again comes from feeling proud about who you are. Going to school, not being tired, being able to engage with studies and being able to deliver on what you would normally think a child should deliver when they're being school ready. and your self-actualization as well. Next slide, please. So in the literature, we know that these are some of the things that you probably know about. What is the impact of homelessness on families and particularly children? And you can't really divide families and children and separate them because, you know, the parents' impact on the child, the stress of the parent has an impact on the child and vice versa. So if you are moving, you don't know if you can pay your bills the next day, and you can see there's an interlink between poverty and homelessness here that's sometimes very difficult to divide up or separate. A parent will feel stressful, they'll feel stigmatized, isolated. Sometimes, you know, they can't feed themselves. This then has an impact if you're going to be having babies on your own health, leading to premature births, low birth weight, and we know the impact on child health for that, and disrupted attachments as well. Impact on the 0 to 5-year-olds, which we're particularly interested in because this is the early years, that critical time in a child's life when their brain is developing at the fastest rate that they possibly can. And that leads to there can be low GP registration at this time, higher hospital admission. We know missed immunisations, and we'll come back to this, developmental delay and chronic health issues such as asthma and other respiratory problems as well. And then that has a knock-on effect as you get older and older with behavioural problems, feeling that you're not good enough in school, not being able to attain what maybe your colleagues can, and linking to either malnutrition, so vitamin deficiencies, or even obesity. Next slide, please. And this is a simplified, and I say simplified because I have a very complex diagram that we're actually revising at the moment. But the aim of this is to really show the interlinkages between everything, that you cannot divide these things up. You have to think, as we've talked before, about a holistic approach. A child's lifestyle is actually impacted by their environment, their resources, their access to funds, you know, poverty. And if any of those are impacted on, they may be less active. If you're in a tiny little room because you're homeless and you're in a B&B, you can't really move around, so you're not going to be very active. It affects your bones and how your bones are growing, your muscle development. Your diet is going to be, it could be poor because you haven't got a fridge or you can't cook fresh food. And then that may have a knock-on effect with vitamin deficiency. And all of this then has an impact on your mental health and your levels of anxiety, your levels of depression, even in children. And children also under 5 have mental health problems that we don't really talk about a lot. We have environmental challenges such as smoke, which again we know has an impact on asthma and respiratory problems, mold, and vermin as well. So we know cockroaches, rats carry infections with them. And again, we don't really talk about those sort of infections that are transmitted through other means, really. And lack of resources. You have restricted access to healthcare systems, delayed diagnosis and delayed treatment as well. And as we've said, if you don't have a notification system, you can end up moving from place to place, trying to find a GP or a dentist again, and then just dropping down the list, and you have to start all over, climbing up this ladder again and again and again, and that's just so tiring. Next slide, please. So our project, the Champions Project, as I mentioned, is really trying to work really hard to find the evidence or to explore with families what the impact of homelessness is on children, and also to discuss this with professionals as well. And so from your perspective, find out what could be done and what some of the solutions are to improve the systems around a child. We want to produce evidence. We want strategic communication with colleagues like yourselves who are on the front line, and how can we make a difference and a change utilising the evidence that we hope to produce. We want to empower families as well, and what we're trying to do is create a knowledge platform that I'll describe in a minute, where families can actually put some quotes up, they can send us pictures, they can have a voice where there's no gatekeeper really, so the voices come directly from the families themselves. And we want to try and be an advocate. I'm in a position where luckily I am in an academic organisation, I am in a healthcare organisation, and with your support we want to develop a sort of consortium approach where we can bring all the voices together nationally and then be advocates for the families and change the narrative a little bit. So it's not about blaming the families, but it's about what is the impact on the child who is going to be part of our society, or who is already part of our society, and who will grow into adults tomorrow. Next slide, please. A key part of this, as we all know, is co-production. We have a community engagement team of families who've come together, and every step of the way we work with them, because they need to be telling us what they need, and they need to be also making sure that the language that we use and how we communicate their voices is done in a way that is sensitive to their perspectives and to their voices as well. And I think in everything we do, we have to be very, very careful that we do not take a position of our own, but we actually work with the families and let them lead the agenda for themselves as well. Next slide, please. So the Champions Project has a number of packages, work packages. We've already done a scoping review, and I'll mention that briefly. We've been doing a needs assessment where we've been interviewing families and also interviewing professionals as well. We're currently asking people to complete surveys online. That's families, professionals, volunteers, anybody really who has any thoughts on what could be done to address the situation and improve it for the families. So please do take part in our survey. And as I say, a knowledge platform, a website where we share information, and hopefully that will become a resource that other people can use as well. And then we will be holding some workshops with yourselves and others to then co-produce recommendations that we can feed into the all parliamentary groups or into the clinical strategic discussions or the HEEs or anywhere else, commissioners, to bring about change. Thank you. Next slide. So what did our scoping review find? Well, you can actually have a look at the insights into our review on the web platform. And this is just 3 points out of a very, very massive review. But what was clear was that when we looked at data and information from low middle income countries, where there are very many marginalised communities, how did people reach them? I mean, you know, you'd think the UK is quite small and we can't reach people. And we all say families aren't hard to reach, we don't reach them. So how have people done this in low middle income countries? We've seen in the pandemic the use of mobile buses, the mobile units, pop-up vaccination centres has really, really come into vogue. But this has been done for many years in other countries, taking buses around to places, taking mobile units to reach children, to immunise children, to do developmental assessments, to assess their dental health. And this is something that I hope to, again, to work with you all on. Can we actually channel some of the learnings we've had from the mobile units through the COVID pandemic into accessing families who are experiencing homelessness as well? More community-based primary healthcare. We talked about what Shared Health Foundation are doing, community outreach workers. We are in institutions, whatever we think, and sometimes there is a distrust for some of the families. So how can we work more effectively with link workers, people from the community, from working with people trust, and linking people to the healthcare system or the education or the housing system? And mobile technology, yes, well, we know that data is sometimes hard to pay for. We know Wi-Fi is hard, but there are simple technology solutions that have been used in other countries. For example, radios where they've used solar power so that they can educate children who are in marginalised communities, where they don't have laptops, where they don't have expensive computers, but we can still communicate with families as well. Next slide, please. So we talked about this in the knowledge platform. The knowledge platform is on our website, and we are hosting stories there. So if you'd like to send us any stories, whether it's professional stories, experiences, or family stories, we're hosting stories, quotes, words that then the aim is to get a dialogue going. The more we have a dialogue, the more the narrative will change. We have advice and resources there, and we do place our research insights there very, very early on. So we're not waiting for 3 years when we have a paper published and time has moved on. We will keep filtering in our information onto the knowledge platform. Thank you. Next slide. So what else have we been doing? Well, we know that many people will not read reports. We know that many people will not read papers at all. And getting a lot of information out to an audience is difficult through words. So we've been engaging with the creative arts as well, to raise awareness about homelessness and to raise awareness through the voices of the families. So we're going to be having digital stories, but most recently we've been hosting some art workshops with families, and particularly with young children, so that the children can draw how they feel about their futures, how they feel about the home, what does a safe home mean to them, And the aim is that we then use this artwork around the UK, paint it on walls, or in other areas, put up exhibitions, so that we can again start a discussion going, but doing it through the arts as well. So again, if you have any walls anywhere that you wish to give us, or any small pockets of money so that we can actually host some more workshops and art workshops, please do contact us. Next slide, please. Some emerging findings just to share with you, and some themes. These are very, very early findings, but I thought I'd share some things with you at the moment. So I think, none of this is things you don't know, but it's important to find the evidence to support what your thoughts are. Food and eating. We know that during the pandemic, there's been a change in diet. People have not had access to the same foods. Sometimes people say they can't find culturally sensitive foods either. And particularly in the B&Bs and sometimes in food banks as well, there are some families who are used to certain types of food that their children want to eat, can't find them. And of course, we can say every child should eat whatever they're given, but that isn't the reality. And so just being sensitive that people come from diverse communities and how can we make food inclusive and tailored to their needs is important. But also people don't have kitchens, they don't have fridges. So fast food means that children are at risk of obesity, and then we'll have an epidemic of diabetes and obesity coming our way. Or the opposite way, they have a lack of food, and then we have problems with low weight as well. Sanitation, we know that families are still using shared kitchens and bathrooms, and we're hearing some very tragic stories about children having to use potties in cupboards because they're too scared to go out and use the shared bathrooms. Or particularly in the pandemic, when the guidance was to stay away from each other, but then you're using shared bathrooms, and there's confusion about what do we do so we prevent ourselves getting an infection, but we also need to use the bathroom. And sanitation is something we don't talk about in the UK at all, water sanitation, and yet we're finding families who are actually struggling with some of the basic needs in life. Well-being, we talked about mental health, mood, behaviour, these have really been impacted on during the pandemic, particularly when there's been lockdown or reduced social interaction. And this then has an effect on physical well-being, but also development, speech, language, social development, which then means it impacts on school readiness as well. Next slide, please. Families' relationships as well. When people are overcrowded, it creates stress. And we're finding that children are having to sleep on the floor, sometimes where there are rats, sometimes when there are cockroaches. The mother's had to sleep on the bed because she's pregnant, just my partner has to sleep with them on the floor. This can cause break in relationships. The next quote is, my son cried when we walked through my granddad's door because he hadn't seen my granddad in 6 months. He didn't recognise him. And when families are really thrown across different parts of the country and then have no means of contacting each other or accessing each other, of course it puts a stress, and the support systems do break down. That again leads, as you can see, next one leads to stress, and the stress can be seen in very young children. Children become withdrawn, they have temper tantrums, they have mood swings, and then that does have a knock-on effect of when they go to school. And children have been, particularly in the pandemic, and we have the children who've been born in the pandemic who've not seen other children very much and who have not learned how to play, and this has a impact on their development, being able to share toys, being able to know actually and not be fearful of other people. And this feeling of noise and feeling unsafe, which I've talked about before. If you can see in this quote here, she kept being sick because of stress and lack of sleep. We have to stay in our room because she never plays like that. She thinks we are punishing her. Next slide, please. Professionals have also talked to us, and this is a key part. We want to be balanced, and we know that professionals are really trying hard. There are many health visitors and midwives who are reaching out to families, but really struggling with the lack of resources that they have. And the challenges during COVID have become much worse. How do we overcome that? And how do we actually look forward to rebuilding these children's lives? We've had to have virtual appointments, so some families have never been seen. Nobody's actually been able to see what's going on behind those closed doors. Families have had limited options, and professionals are having to try and juggle how they can get families homes and not put them in B&Bs, put them in safe accommodation. We've talked about notification and data sharing. It seems to be a key issue. If we can't data share, we can't share names of people, we can't share where people go. How do we create an integrated system around a child when they move from borough to borough or city to city? And how do we deal with the basic needs? Professionals are actually spending a lot of the time just trying to get children's basic needs, such as nappies and beds and food, without even thinking of their health or their other developmental needs or immunisations. So we're really in a bit of a crisis, I would say. Next slide, please. We really, one of the things I always say is we need to change the narrative. And until we change the narrative, it's really hard to take action. This is not about, as I say, just providing a roof over a child's head. This is about child health and well-being and educational well-being as well. And it's about looking at what does a child need to make them a better adult? How can we give them a balanced diet if they're not able to access different ranges of food, if nobody can cook because they haven't got a cooker, if they don't have a fridge? How can they do better at school if they've got nowhere to do their homework, if there's noise around them, if they're not sleeping at night? And how can we create secure individuals who, as we say, are not at risk of being missed out of the employment ladder, who are not at risk of going into gangs, who are not at risk of being taken advantage of, because they haven't developed that feeling of security, or they have been impacted by trauma when they were young. Next slide, please. So all in all, what can I say? We have an increasing problem with poverty in the UK. We have an increasing problem with homelessness in the UK. We have a whole host of children who have been born during the pandemic. This will have an effect on their lives, and we need to start working together now to be able to change some of that, and to be actually, as we say, if we all come together, we'll make a bigger change. If we work separately, it's much harder to do. So let's join hands to do that. If you can complete our surveys, we need the evidence. Without evidence, we can't take action. So we'd be very, very grateful for all your support for our project and for the days ahead. Thank you very much.
Thank you, Monica. Thank you.
Thank you, Monica. My name is Lisa Gavin, and I'm the Clinical Service Manager for the Inclusion Health team in Surrey. And it's been very interesting hearing about what Monica and Sam have been talking about, because it absolutely reflects what we see in our work. What I'd like to talk about today is much of it has already been covered by the two previous speakers, but looking at the impact of homelessness on children. Now, we know that there are a number of kinds of homelessness. Next slide, please. So the difference between childhood homelessness and rough sleeping, which is what most people understand homelessness to be, is that tragic and challenging as the situation with rough sleeping is, and we definitely have we need to end homelessness, full stop. But this is very visible. When we're talking about children and homelessness, it's very much more hidden. And that's why, as Monica has alluded to, people don't necessarily see homeless children, because they're not looking for that child that's on the side of the road. But there are so many groups, and when we're looking purely at the figures across the UK, well, across England, the recent shelter figures, as Sam alluded to, from June 2020, was that there were approximately 127,000 children experiencing homelessness, and these include children who are in a range of emergency and temporary accommodation in all sorts of places. So we're talking about those who are living in B&Bs, yes, those who are in hotels. There are all the children who are in women's aid refuges fleeing domestic violence. There are people in council accommodation in overcrowding. And of course, over the last 12 months, we've seen a huge increase in the numbers of asylum seekers and refugees, including the families who've been recently evacuated from Afghanistan. And they all come with their unique and different challenges. But what we do know is all of these children have experienced trauma. And much as Monica was just saying, we need to look beyond without any judgment, but actually to be aware that these children come into our schools, come into doctor surgeries with a whole range of traumas and experiences that they have carried with them, that may not be visible, but they're definitely impacted and exacerbated by the homelessness that they're currently experiencing. Just on the subject of the asylum seekers and refugees, we're now seeing some of the families that arrived from Afghanistan at the end of August where the feeling of relief from being evacuated from that system, those circumstances, was so great that even the adults were struggling to describe the difficulties that they have now, because there was so much about their relief and just dealing with the emergencies like getting medication, that sort of thing. Now we're seeing other things emerge. We're seeing the trauma, we're seeing the flashbacks, we're seeing children who aren't able to sleep properly at night, we're seeing children who are unhappy with the food that is being offered to them in the hotels because it's unfamiliar. And all of those are exacerbating this weight of trauma that these children and their parents are carrying. And this is just one particular cohort. But I suppose what I'd like to say is we need to look at all the specific experiences that all of the different groups of children who are experiencing homelessness come with, and be flexible and understanding and listen to the stories that they tell us, so that we can actually respond to their needs and try to give them the support that they really need in order to grow and develop and go on to have happy, healthy lives, which is a big challenge with all of these obstacles in their way. So the other group is, again, this is very much a hidden one, children who are living in houses of multiple occupancy where they're having to share a bedroom with lots of other extended family members. And a lot of this has got worse during the pandemic. Children who are in overcrowded, unsuitable accommodation before they've even claimed homelessness. Children who are with parents who are sofa surfing. And again, we've seen a great increase in that because of the pandemic. Parents losing their incomes, people getting into debt, and range of reasons where their parents have relationship breakdowns, all that sort of thing, that have contributed to those families now being homeless in one form or another. The other group that I would like to talk about is the Gypsy Roma Traveller communities. Now, largely in this country, gypsies and travellers live in housed accommodation. That means they are also hidden within the communities. And again, these are groups of people who experience discrimination and the lived experience of discrimination. There's a lot of evidence to show that actually that's very detrimental to children's health. So whether they're going to school and they're being called names, whether they're struggling with their homework because their parents have low literacy and they're not able to help them with their homework. But they also tend to move around a lot. So while a number of people are well settled in their homes, they can still be excluded, and they are, because of the strong family networks within those communities, it may be that they're being moved around between different family members, or they're taking other family members into their homes as well. But the other group that specifically I wanted to refer to here are the nomadic Gypsy Roma travellers, who are people who have the nomadism is part of their identity. It is whether people are settled in houses or not, but the families who genuinely have nowhere to go, and that's because there's an acute and chronic shortage of pitches on traveller sites. There's a huge shortage of transit sites for people who are moving around the country, which is their way of life. And that means that can be very difficult to access education, to access medical care in a timely way, all those sorts of things as well. The other groups of children, we've talked about fleeing domestic abuse. Now that encompasses things, whether they're in a refuge or whether in homeless accommodation, or whether they've moved from the other side of the country and they're living with family members. But that's a huge and often hidden area, unless they're actually identified by living in a women's aid refuge. These children are carrying with them all of the trauma that they've experienced through the domestic abuse they've been witness to. And that's very significant as far as their mental health, their development, and a number of areas of child health as well. The parents' chaotic lives, the things that are going on in parents' lives that cause homelessness have very much an effect on the children, and as has been said before, and the children's distress impacts on the parents' mental health as well. So poor mental health, a number of things, and such as substance misuse, debt, poor health, people losing their jobs, relationship breakdowns, and all of these things, as we've said before, have been exacerbated by COVID. And as I mentioned before, the asylum seekers and refugees who have the numbers have been hugely increased over the last couple of years, particularly over the last 6 months. And so that's been an emerging challenge for us when we're trying to support children experiencing homelessness. Next slide, please. So looking at this is a very similar image to previous ones that have been shown. But if we look just at a child, one of those children, you look at that little girl sitting on the bed there, probably trying to do her homework, being in an environment where a lot of the work is online, and certainly during COVID, we saw a number of children who were absolutely unable to access the education that their schools were providing, and often the schools didn't know that the children were in homeless accommodation, because there's a lot of embarrassment and shame for families to admit this. They see this very much as a failure themselves, and that's really difficult, and it's a huge burden for the parents to carry. But if you are excluded, both with digital exclusion by not being able to have Wi-Fi, maybe having to do your homework on your mother's phone with limited data, that is that's going to have an immediate impact on your capacity as a child to keep up with your peers. In a room like this, we hear all the time that parents are saying that their children won't go to sleep until midnight. If they're all there in a room together, they can't have the routines, they can't have the structure, they probably haven't had a healthy meal because of the reasons described before: access to cooking, access to healthy vegetables and food, and being able to cook, lack of storage for these things, all those things that collide together to make this very, very difficult for children to manage their behaviour. And of course, not being able to eat healthy food, and we all know that junk food is cheap food, and if you're struggling, then it's not a question of moralistic choices that we as health professionals might say about eating healthy food. The choices that parents have are very limited when their finances are very limited. So nutrition is a real challenge, and many parents really struggle with that and feel really bad about that. But if children are missing their sleep, we know that they're then going into school. They're very often having the out of borough placements that were discussed before. So they're very often not placed in the borough where they're registered with. And it's very difficult to get a child re-registered in another school, but actually many parents feel that school might be the only stable part of that child's life at that point. So the idea of moving them from a school where they have their friends, where they have some stability, where the teachers know them, is really difficult, and many parents will go to enormous lengths to keep their children in the schools, even if they have to travel on several buses to and fro to get their children to school. And then, of course, there's the challenge of those poor children being exhausted, and the parents, by the journeys that they have to make in order to get them to school. So if you put that all together, limited, poor diet, poor sleep, no access to be able to bring their friends home from school because of there's no space in a single room, and parents often do not want other parents to know that they're homeless for understandable reasons. So the social impact is just as important as the developmental and the health impact on this child, and all of those will impact on their development, on their mental health, and long term there are all sorts of complications. So if, for example, as has been mentioned before, if a child has a respiratory condition such as asthma, that very often we see that chronic conditions are poorly managed because it's difficult for onward referrals to get to where they need to be able to go to a GP that knows that child and knows that history. And if they've been referrals have been made at their previous address, often letters don't reach the families. They might be moving frequently, and so they miss appointments, they miss seeing consultants, and it's very, very difficult for parents to keep track of all of these things. So the sum total of that is that the outcomes are poor, the chronic conditions are poorly managed, things may not be addressed in a timely way, dental appointments are very often missed, the immunizations are also often missed, and the routine checks and any relationships that these families may have built up with previous professionals are lost when the family gets moved on. And from a professional's perspective, it can be very, very difficult to find out where the families have gone to because of the issues around data sharing and notification. And that's a huge challenge for all of us, for the families, and certainly for us as professionals working with them as well. We've talked already about the unsuitable environment, whether we're talking about vermin, noise, exposure to other adults, because this is an issue with a lot of children being exposed to adults who are homeless for various other reasons. So there may be people who are taking drugs, who are where there's domestic abuse going on, and they're mixed in this community of rooms, B&Bs, hotels, wherever they happen to be, and these children are exposed to things that we would not want any child to be exposed to. That's very stressful for children, and just as we know that there are huge impacts for children who've been exposed to domestic abuse, even if they haven't been in the room, likewise these multiple traumas that children are exposed to in their current state of homelessness is going to have an impact on their developing brains and their own mental health as they move forward. They've mentioned previously about the shared facilities, and that's particularly been an issue during COVID, with people being fearful and of picking up COVID, and also being given the advice about how they are supposed to be isolating and not using shared facilities, but what choice do they have with all the complications that have already been mentioned. We do know that there's a very strong link between the outcomes for homeless children and a greatly increased risk of these children becoming homeless in adulthood. So there are many, many reasons why we really need to address this and limit the impact of homelessness on children. We know that their social development, their integration with society, and their achievements, both educationally and their life chances, are greatly reduced when they experience homelessness. So this is, and even just having that sense of agency, being able to make choices for yourself, being confident enough to know that choices that you make will give them the tools to be able to be a resourceful adult. It can be very difficult if they've seen their own parents struggling and they've not had anything but negative experiences. That definitely feeds the outlook and their capacity to deal with challenges as they become adults themselves. And of course, the last thing is that many families are then disconnected from their support network, whether that is their extended family or trusted professionals, and that can be really challenging as well. Next slide, please. So I think we've had that one. Yes, so much of the solution has been already raised by both Sam and Monica. I think that there are a few specific things that I just like to pick out. So supporting families to get GP registration, a temporary registration locally as quickly as possible is certainly very important, so that any health issues can be addressed. And we need to follow them up. It's not enough just to leave them there, and families often need to be supported with that, with negotiating the registration process. We find for example, with Gypsies and Travellers, that we may arrange temporary registrations for people who are nomadic and who've arrived in an unauthorised encampment somewhere, but that's a very short window of opportunity to do as much as we possibly can. And sometimes we have GP surgeries who are sympathetic and happy to accommodate that. And I'm talking about things like quickly arranging smears, antenatal care, catch-up immunisations for children, that sort of thing. And others, at times, it's much more of a struggle. But if we could make the concept of homelessness, the homelessness of children, as Sam has said, to be recognised as an adverse childhood experience, it would be so much easier to get other services to understand how the impact of hidden homelessness really affects the outcomes for children. We do need to look at minimum standards of accommodation. We know that it's very variable, and many of us within the health professions will challenge this. But because of the shortage of housing across the country, we know that substandard accommodation is considered acceptable because there is no alternative in many occasions. That needs to be challenged at the highest level, and that needs to be constantly brought up as an additional trauma that we're putting families and children through, and also the impact on their already disadvantaged situation. The information sharing we've mentioned before, anything we can do to improve information sharing between organisations, between health professionals, between housing and the notification of families moving in and out would make a huge difference. If we knew about families, then we'd be able to act much more quickly and try to minimise the damage that's being caused by delays. At the moment, there's a lot of detective work in this role of actually going out and finding people and knocking on doors and trying to get information. And again, that varies very much from every district and borough. So getting a wider system change approach to understand the impact of homelessness on children is absolutely critical. The targeted support, we need to look at investment, and whether when we speak about inclusion health, that we look at all of the excluded groups and all of their very specific needs, and really prioritise this in both education but also in commissioning of health services. Because apart from anything else, purely from financial reasons, if we invest in supporting our most vulnerable clients, quite apart from the moral imperative, we are actually saving money in the long run, because we're not having lots of missed appointments. We're having a smoother patient journey, a better experience, better health outcomes, and that is less costly to the NHS in the long run. But we're storing up problems from mental health to untreated health conditions for the future, with everything including diet and potential obesity and diabetes and the heart disease and the links from that, if we don't invest in inclusion health services at this point now. So I would urge commissioners to really look at how important this is, not as an add-on, as another element, but looking at how do we really work to level up and address the disparities in health that are existing right now and have become hugely increased during the pandemic. And I recognise that that's a challenge with all of the additional costs that have been thrown up by the pandemic, but nevertheless, that's really where we need to be focusing in the area of greatest need. I think we need to recognise the challenge that homeless children face every day. There's the tired child that's falling asleep, who hasn't been given any breakfast or has had junk food for his evening meal and is falling asleep in the classroom because isn't able to have a proper night's sleep because he's sharing with several siblings. That's something that I think that we need to flag up, not just in health, but in education, so that we are genuinely looking at this in a system-wide way at the impact on every area, from housing to education to health and beyond. I've already mentioned about improving the notification system. That's really fundamental. Addressing the causes of childhood homelessness. And these children are experiencing the traumas because of the traumas that their parents are experiencing. So empathetic and trauma-informed approach to families who are experiencing homelessness. It still seems to be quite punitive in many ways. The whole process of applying for housing is a very challenging one, and that is difficult and traumatic for the parents, and the children are the victims of a situation that they have no control over. So we need to support the parents in order to support the children. We need to make sure that children's needs are prioritised when we're looking at the rough sleeping and other initiatives, and particularly with the homelessness reduction strategy. And there's much good work that's going on to highlight these needs. But for the general public, I think when we say the word homeless, they're still thinking about the rough sleeper on the street, which, as we know, is a very small percentage of the numbers that we're looking at when we speak about children and families we need to lobby and improve the standard of and quantity of the housing stock nationally. And actually, thank you to Sam and Shared Health, because a lot of that work that's been going on is being driven by the work and the research that he and others are involved in. And we also need to look at the enforcement of the current rules and legislation, because what we do know is that there are a number of strategies and there's legislation in place, but very often that's ignored because of the pressures on housing and the pressures on staffing in housing and all of the issues that come out of that. But we need to be robust in our defence of what ought to be the standards that it should be delivered for children. Next slide, please. So this is the last one. It's just got my contact details are there. And I just wanted to finish to say that we've done a lot of joint work with other agencies. The work that we've done some work with Friends, Family and Travellers around education, and there are a number of initiatives that we have in Surrey where we have a Gypsy Roma Traveller strategy group, which is made up of many professionals from all sorts of different groups. And the combined efforts of all of the different trusted people who are working with different communities is really the only key for success for overhauling homelessness and its impact on children. And that is just as true in the GRT arena as in all the other areas of homelessness, where we work together with our colleagues in housing, in education and in health. So I'd just like to finish by echoing what my predecessors have said about the importance of joint working and joining up what happens at the commissioning end with what happens at the coalface. And I'm hopeful that we can actually address and end homelessness for children at some point in the near future. Thank you.
I hope that there's a bit of time left for discussion. So are there any questions that people want to pose to any of our speakers? I know we've got a very small panel here.
I suppose it's not a question, it's more reflecting, especially the work I've done amongst families who experience exclusion. And I think one of the big issues has always been the need for notifications and a good notification system. So we did have one in London called Notify, but I don't think that's running, and that was or working efficiently at all at the moment. And that was set up following the death of Victoria Clumbier. So it's a long time ago, and yet we're still talking about it. And that was a recommendation to actually set up a notification system in London, and that's how Notify came into being. And you know, we have seen in some of the deaths of children that when they've looked at their housing status, they were actually homeless. So it's such an important issue. And the other thing which needs also consideration is definitely to stop the use of B&B for families, but also looking at standards of accommodation. So I don't know if Sam wants to say any more about that, because I know there is that gold standard that has been developed in Manchester around putting families into accommodation and what the expectations are. Because I know some families, it's not only about, it's like Monica said, what is a home? So it's not only the standards of accommodation, but you know, you hear sometimes of families who go in and there's no fridge, cooker, you know, the basics just aren't there for family to start up, you know, living their lives really as they should be able to.
Yeah, absolutely agree with you there, Jane. We a couple of years ago went around all the B&Bs in Greater Manchester and ranked them on what they had in terms of facilities and accessibility to supermarkets and schools and GPs and just, you know, the real basic stuff, and ranked them in the kind of, you know, okay, would be fine for a couple of nights, not great, ones that would need improvement, and ones that, you know, you want to bulldoze now and never send a child there ever again. And through just campaigning and kind of working with the local authority is that, you know, Greater Manchester aren't using, Manchester aren't using B&Bs anymore. or the certain ones that we didn't want them to, and then we're going to re-procure all homeless accommodation over the whole of the county, which is quite an effort really. So they've realised the kind of the danger that it can be to put children in these types of accommodation, and then also implement standards across all the local authorities to make sure that they have the basic things like fridges and washing machines, which is still going on. I go into properties and help families move into their houses, and there's nothing there. There's not even carpets on the floor, and they're classed as suitable accommodation. Well, I don't know about you, but I wouldn't want to live there. There's no carpet and there's no fridge and there's no washing machine, and you're not near a supermarket, and you're 2 bus rides away to school to take your kids there. So, luckily the local authority are working really hard to kind of re-procure all of it, which is a big job. But a kind of a brave move as well to take the children's and families' health really seriously, because as everyone said here today, it's not rough sleeping isn't the only problem. It's the hidden homeless that is hidden for a reason, really.
I think we'll pick that up as part of our Children and Young People's Mental Health Network. Jenny was on the call a bit earlier, but she's had to go. But we'll pick that up and see if we can promote that gold standard across the South East.
And I think it's also, Debbie, ensuring that converted office blocks are not used, because we've seen that very much in London and outside places like Essex, where they've converted office blocks into, and I'm not sure about Crawley, Lisa, but and putting families where they can just fit in beds, so children don't even touch, their feet don't even touch the floor. So when you're thinking of, being able to crawl and explore and learning to walk, that just doesn't happen. So it is, I think, really emphasising that is just not, should not be happening.
And it also seems like there's like 2 standards. One, if you're a family who live in your own home, if anybody came into your home, you are assessed according to how safe is your house, what do you have in your house, are you being a good parent, are you providing the basic needs for your child? And if you're not, people will bring in help, support, there will be a discussion over it. However, if you're placed in an environment which isn't because of your own doing, it seems as though nothing's done about it. So it's like, how come there is one rule for one and one rule for another? So a child who falls over in an accommodation that's provided for them, or breaks a leg, or something happens because they're in a bed that's too high or whatever, that seems to be acceptable. But if a parent did that in their own home, it would not be acceptable. Surely the standards should be the same for any provision of a home for a child, whoever provides it.
That's a really interesting concept, Monica. Where is it unwritten? Is it a biased view that manifests, or is there written guidance on that? Is it individuals where they turn a blind eye, where it's statutory provision and then not? Is it something that is unconscious bias?
I think it's unconscious in the way of, so it's a complex issue, but if a child is in their own home, something happens, they get assessed, obviously for safeguarding, so it becomes a safeguarding issue. And then obviously it's like, what have the parents done about it? Well, if the parent is in their own home, they are identified as, you can do something about it. But if they're in accommodation that isn't their own home, they will still be told that they're in a chaotic home, or they will still be blamed for it. But yet the fault isn't their own. But what do they do about it? So the problem is that the discussion then doesn't filter backwards. It sits, and the poor family have to hold that responsibility. It's not down to their fault. But should we be turning it on its head into saying that, well, actually, when children are placed in homes, the responsibility should be there from the beginning when a child is placed in a home? And I think that's what we're trying to say about minimum standards. Yes, no, not everybody can have a washing machine, but you should have access to being able to wash your child's clothes. If you've got a baby and they're vomiting all the time, because again, if you can't, and that child is unclean and they get infections and they get ill and they get diarrhea and all of the rest of the cycle starts, what will happen? It'll be the parents who are blamed for it again, for not providing the provisions for their child, not the people who placed us in that accommodation, or the same if there's mould on the walls, or if there's any other type of unsafe accommodation. Or we are seeing as well, because fridges aren't there, some children have medication and they cannot put their medication in a fridge, which means again that child's health is at risk. But these things are not talked about very much.
Can we pick this up, Vicky, with the framework that we're looking at developing? Because so we have produced in the Southeaster a transition framework with a number of factors like accommodation, leadership, multi-agency partnership. We're including an additional one on safeguarding, where it's aspirational rather than a RAG-rated type of structure. But I'm thinking that some of these we could look at developing and promoting and then championing across the Southeast, couldn't we? Do you know if anyone's produced guidelines or recommendation gold standards that we could refer to as part of our framework? Have any of the major organisations, you know, the faculties for child health, so has anyone developed this piece of work already, or is it something that would need to be done?
I think Sam's been looking into that more, haven't you, Sam? I don't think the College of Paediatrics have done something like that, but Sam, I know locally you've been trying to do that, haven't you?
Yeah, absolutely. So our gold standard framework is what's been implemented in Greater Manchester, but you know, we're an organisation of 12 people. You know, we're not the faculty of paediatricians or anything like that. So,
but I'm thinking some of the Royal Colleges can take this up and champion this. We're wanting an advocacy body to champion this, and then we can all work towards that.
And I think,
Lisa and I are working on revising a guidance that was produced quite a while ago about 15 years ago from the homeless health programme at the Queen's Nursing Institute. So originally it's called Safeguarding Homeless Families, and at the back is actually 2 sheets, one for children and one for families, because the other issue was very often a commissioner would say, oh, you've got, I don't know, 12 families on your caseload, but actually don't look at what's behind that. So we were developing, and Lisa and I have been involved in reviewing those, looking at, you know, what are the issues, and some of the issues we've discussed today, we would put down on an assessment sheet. So it's quite detailed, which I'm sure we can share with you. And then we're hoping one of our colleagues is going to rewrite the front piece, which is much more detailed around the legislation that goes behind, you know, working with families. And I think one of the issues as well, which we probably don't talk enough about, is the rights of children. You know, there's a universal right that are expected for children to be able to develop into adulthood. And so hopefully we'll include that in our guidance. But yeah, we just need to chase up what's happening with that, really.
And we actually do need and I suppose this was one of the reasons why we wanted to do the research, because as we say, we all know what's going on, but unless you have data, it's very hard to persuade people. And, you know, what we're seeing is this need for a you talked about Royal Colleges, but not individual Royal Colleges. It's like you have a cross-parliamentary group, you need a cross-institution, cross-college, cross-whatever group to come together and say, actually, we need something with all the colleges, with all the faculties working together, whether it's emergency care, whether it's housing, whether it's education, whether it's Royal College of Paediatrics, Institute of Health Visiting and Midwifery as well, and the RCOUG. You know, we need it all to come, and mental health. And people always forget that children have mental health problems, and the little ones have mental health problems as well. But I sort of feel we need that interdisciplinary approach to this, and one document that then is nationally accepted. We can't do it through NICE, and so, you know, I sort of feel we need to find another avenue to be able to do this together. And otherwise people are having to do this and replicate it in silos rather than having and also if a family's moving from borough to borough or from city to city, they have to start all over again explaining themselves. And unless we have this national approach to this, we're going to keep, you know, going up a few steps and coming down.
Yeah.
The other thing I would like to say is that even within health, there are so many barriers, whether we're talking about between health visitors and midwifery services, between acute and private and public health, within maternities. There are so many. It's so not joined up, and I think that actually one of the opportunities we have within the new ICSs, and there is being able to integrate things and embed a lot of this learning and make it almost compulsory as things are being rewritten, that we look at what is best practice and aim for best practice, and even where we fall short, that actually that's what we aim for, a bit like the gold standard with education. So we really need to have a framework that we're actually saying that this is what we aspire to, and this is what even if we haven't got there, so that there's a recognition. And we do a lot of work. I mean, everything about this inclusion health teams around advocacy and collaboration, because we're very well aware that as a very small team, we just absolutely can't do this ourselves, and collaboration works so much better. It is challenging, but it's really very much worth it. And I think that it's also very time consuming to invest in that collaborative work initially, but I think it's a worthwhile investment. And I think that if we can embed that approach as we're looking at integrating systems, then they really will genuinely be integrated.
Yeah. And one more challenge to think about it that I'm seeing more and more as well is that we have different recommendations and documents. I'm not saying this is right or wrong. I think it's just sometimes you have to work with what you have. But for children who are refugees or asylum seekers, and then we don't have anything for children who are experiencing homelessness for other reasons. And again, we've got this inequality going on between both groups. And in some way, how do we join those up, really? How do we put the family and the child and say, all of these children are experiencing homelessness? Their health needs are the same, their education needs are the same. We want them all to become healthy adults and well-rounded adults. But we're still ending up with silos between groups of homelessness as well.
Yeah, absolutely right. And I think it's recognising where they intersect, because so many of the issues are common to all of those groups. But you're quite right that they've been considered through the lens of whether they're refugees and asylum seekers or GRT or whatever. So I personally think that it's good that there is more talk about inclusion health, and so far a lot of that is very much focused on adults. But I really think it needs to be focused on children. We need to draw that together.
Yeah, it probably just needs to be called Children First. Yes. And I was just thinking about what both Sam and Monica and Lisa have said, also that model that we know that works of community engagement, community development, but also looking at cultural competency. What does that mean? Because I think people don't always understand that of what it means with both not only asylum seekers and refugees, but also the traveller community. So what does it mean to provide a service that is appropriate for them and taking into account the cultures and the need for interpreters and link workers from their own community as well, who speak their language and understand the culture. So it's a lot to do, but it's great that the all-party parliamentary group is being set up, because I think that has the opportunity to really influence as well at quite a strategic level.
So this is the all-party group on?
All-party in temporary accommodation.
And they're going to look at the whole thing?
Yes, so we've got a list of kind of quick wins for addressing standards and notification systems and things like that we can implement now. And then we're going to look at an inquiry at temporary accommodation and the reasons for homelessness for children on a wider scale. So we've got kind of short, medium, long-term goals. And we had our first meeting just a couple of weeks ago before Christmas.
So do you provide the secretariat for that all parliamentary group then?
Yes.
Oh, excellent then. So the suggestion about calling for somebody to do this piece of work could come from that all parliamentary group.
Yes.
Could be one of their recommendations.
Yes.
Yes. We might get it. You don't ask, you don't get.
Exactly.
One group as well of professionals we mustn't forget are teachers, and I think teachers are the ones who often are seeing these children who turn up, as we said, at school with other safeguarding issues or mental health challenges or whatever it is, and they're sometimes the first ones to see the children. And yet often when we have these conversations, actually teachers are not at the table. So I think one request would be that we should be drawing in teachers into the conversation with housing and health,
So
the frontline teachers.
We do have a schools mental health project, so across the southeast. So a little note to myself was to go and talk to the person who leads that project. But that's just across the southeast. But other regions will have a similar approach. So it's just about knitting some of these things together, isn't it? That's tricky.
I've heard of some schools where they've actually made washing machines available for families who are homeless because children were coming to school with dirty, smelly clothes, and and then they were really being identified by the children around their housing status. And I know the Magpie Project, which was set up by Jane Williams, who's quite an inspirational woman. I think she was either head teacher or on the board of governors of a school, and she was seeing children who were homeless in Newham coming to school who were hungry, had lots of issues, and she set up the Magpie Project out of that, which is just growing and growing and just having such a huge impact on the lives of families experiencing homelessness. And she's a great champion as well. So she's just a great advocate for families.
And it's that I think also the stigma. So we're hearing, actually over the last few months, we heard there are lots and lots of projects within schools, such as cooking projects or things we take for granted that we think we are helping children. And then I did hear stories about some children who were at the cooking groups who then felt very embarrassed because they didn't want to, the teacher was trying to say, please take these things home, please take these things home and cook them at home. And in the end, a few of the children were like just shying away in this, what's going on here? It's like, I haven't got a cooker at home. I can't cook this at home. What am I going to do with it? And you just thought those are the things that then have that impact on their emotional mental health, their well-being, their exclusion from their friends. And sometimes parents have said that's why they don't want a notification system, because they don't want to be stigmatized. So I think one challenge is, how do we create a notification system that's positive and doesn't feel as though you are stigmatizing families and they're being pointed out as being bad parents because their children are homeless again. So it's a bit of a challenge how to do it in a positive way.
And the disparities of standards across the different local authorities, even ones that are right next to each other, is quite shocking as well.
Yeah.
We earlier on last year, we contacted every local authority in England to ask what their provision were for cots and Moses baskets for babies in temporary accommodation, and the difference in, we go above and beyond, we provide this before the family gets the property, to go find a baby bank yourself. And unfortunately that's kind of the pressures that local authorities are under. So it's not a blame game or anything, but those are the kind of responses that we got back from them of going, sorry, we can't help, you've got to just go find it yourself. But if you're a mum with 3 kids and a baby who's fled domestic violence, been thrown in a temporary accommodation with no carpets, nothing else, safe sleeping kind of goes to the bottom of your list. But we've heard of real stories of SIDS incidents in temporary accommodation just because the council couldn't provide a cot.
You see, I think you're being too gracious. I think that's not an acceptable answer. As most local authority residents would expect signposting as the bare minimum, expecting someone to do it themselves. I think you've been very generous there.
So
I appreciate there's humans as well working behind this, and every civil servant is up to their eyeballs in demands and things like that. Lots of work in funding, but
I'm going to call this to a close, I think. But it's been really useful, and what I was going to suggest is that once I've had a conversation with the people that we've talked about, so we've got a national health inclusion team, we've got the school health project, we've got a children and young person's mental health team. So once I've had those conversations, I think if we could get together as a group once again, I think then we could sort of try and come up with a plan for a way forward, because we'd really like to get something off the ground in the southeast. But
It'd be
thank
nice
you
to
so
do something
much.
later in the year, wouldn't it? Plan for that.
Yeah. Oh, Victoria's put a hand up. Thank you so much for such
Very,
inspirational
yes,
and
indeed.
complimentary presentations. I couldn't have hoped for more.
Yeah.
Thank you, Victoria.
Oh yes, sorry, I have to go, but you're finishing anyway. It was just firstly to share the recording for the link so that we can share it with all of the safeguarding leads in our systems, and also I think a conversation as well with Judy, our CYP commissioner, because it might be something to take to CYP board in region. So that might be a good way of joining it all up.
Good suggestion. Thank you so much, everybody.
Great.
Thank you.
Thank you.
Bye.
Debbie, don't rush off. I just need to chat with you before you go. Thank you,
Okay,
everyone.
I'm just going to stop the recording.
I need to have a conversation about vaccination with you.
So I'm supposed to be on another meeting.
Oh my goodness.
So are you free at 5?
I am. Yes.
I'll call you at 5.
Is that all right? I'll speak to you later.
If you fix something up via Teams, we're joined by Teams.
Super. I'll do that then.
Brilliant.
Lovely. See you
Thanks,
later.
Karen.
Bye.